Did you know that Medicare can charge you a lifetime penalty if you don't sign up in the correct enrollment window? Hey, I'm Joseph Pape, better known as Medicare Joe, and today within our Medicare Basics playlist here, we're going to talk about Part D, how it works, what it covers, and more importantly, how to avoid that costly mistake of enrolling late and having a lifetime penalty assigned to your Medicare Part D coverage. So to really kick off this video, I want to identify what I mean by prescription drug coverage and what I mean by Part D. So Medicare Part D is basically its own standalone prescription drug coverage. If you watched our Medicare Supplement versus Medicare Advantage video, we talk about the left side of Medicare. You have original Medicare with the supplement plan and then a standalone Part D drug plan. That is one identification of drug coverage. If you go with original Medicare, Part D, that is a prescription drug plan. But prescription drug coverage is also offered through Medicare Advantage plans, and it can have the drug plan built in. So again, it's important to know which road of Medicare you're going to be going on, whether it's Medicare Supplement with a drug plan or Medicare Advantage, to understand if you're going to even need to enroll in a drug plan or if your coverage comes with it. For the sake of this video, we're going to talk about Medicare Supplement with original Medicare and adding a Part D drug plan. So these Part D drug plans work very similar to Medicare Advantage. They're offered by private insurance companies. So you're going to have a specific carrier that you purchase their product for the Part D. And the Part D helps cover the cost of brand name medications, generic medications. Even in some cases, it can cover specialty medications. There are exposures, though, with medications that are not covered. I'm going to link the video that I made. It's a little bit lengthier, about 15 minutes long, about how Part D works in detail in the description of this video. And if you want more information, you can go and watch that one. It really identifies, what is covered, what isn't covered by Part D. For the basics video, I want to really simplify how Part D works. So the way that Medicare Part D works is you're going to pay a monthly premium every month. Average is anywhere from $10 a month if you're taking just generics, all the way up to like maybe $50 a month if you're taking some brand name medications in premium. And the plan is going to provide you with prescription drug coverage. Now, you're going to have certain copays that you have to pay on certain medications. To date this video, a lot of generic meds are either free or like a $5 copay per month. And then as you get into more of those brand name medications, that's where you're going to have higher copays like $30 or $40 a month to get your medications. But in simple terms, the way that the Part D works is you're going to have stages of coverage. So you'll have your copay stage. You'll also have what's called a deductible stage. So if you're taking brand name medications, typically the deductible does not apply to generics, but brand name medications, you need to meet a deductible for the year before you end up paying a $30 or a $40 copay. So if you have a $500 deductible, for example, and you're taking a brand name drug that's $600, that first month you may have to pay for the full cost on that drug. And then after that, you'll have just the copay of $30 or $40 to meet that. Now, there is what's called a maximum out-of-pocket that's new to 2025 here, and that's a $2,000 cap that they put on. So if your costs on your plan for medications exceeds $2,000, you no longer pay anything except for your monthly premium. They pay, the plan will pay now for all of the copays you have. So that's the basics of how a drug plan works. It's similar to probably how you had employer coverage, but the late enrollment penalty is the one thing that gets a lot of people. And the problem with that is because if you don't enroll in Part D when you're first eligible for Medicare, right, and you delay that for whatever reason, or you don't sign up, you don't have creditable coverage as an alternative, when you eventually sign up for Medicare later on in life, whether a year or 2 years out, you're going to have a 1% penalty for every month you delayed your coverage. So that 1% is based on the national base premium. So that can differ every year as well. But for every month you delay, you pay a 1% penalty on what the national base premium would have been. So example, if you are delaying 24 months, 2 years, and then you start Medicare, your premium is going to be 24% higher than what every month for the rest of your life. The penalty never goes away. So, even when you're not taking any medications now, a lot of the drug plans are affordable for people that are taking just no medications or generic. Some zip codes have plans that are just a couple dollars, even free in certain circumstances. So if that's you, those are plans you should probably look into just to have that qualification of meeting the requirement of having drug coverage met, so you're not penalized later on, when you decide to get it, possibly later on in life. Now, credible coverage means that you have an alternative that allows you to delay getting a drug plan or forego ever buying one. So that's going to be if you're still working and you're on an employer group plan that has credible coverage, you can delay your Medicare Part B and Part D enrollment for that matter. If you have VA coverage, you don't actually have to purchase a Part D drug plan. If you have TRICARE for life, your TRICARE turns to TRICARE for life, credible Part D coverage. And then some retiree plans, if you have one of those, they're, less and less we see that. But if you do have a retiree plan, as long again as it has what's called credible drug coverage, and your benefit administrator will be able to tell you that allows you to delay your Part D enrollment. If none of those apply to you and you're getting onto Medicare, you need to sign up for Part B within your initial 7-month window of Medicare A and B. So 3 months before your 65th birth month, your birth month, or 3 months after your 65th birth month. If you don't sign up within that window, you need to have what's called credible coverage to avoid having to pay a late enrollment penalty. And if you don't, then you're going to need to purchase a drug plan whenever you get to that point, and you'll have that penalty assessed to you. Now, there are certain circumstances where you're delaying Medicare and you're on an employer plan. That allows you to enroll within what's called a special enrollment period. So that enrollment period would be like, I'm working, I decide to retire, I get off of my work coverage, I would now have a 63-day window to purchase drug coverage. And if I miss that 63-day window of purchasing drug coverage, I'm not able to buy a plan in that plan year anymore. I have to wait till the next enrollment window, and now I would be assessed a lifetime penalty. So again, this is a big topic for folks, and a lot of people get this wrong. If you have questions about that, please drop them in the comments below. If you're turning 65, if a loved one is, or you just have a friend that you're helping out throughout this, drop your questions below. I personally go through all the comments and answer them. Again, in the description, I've linked a more detailed Part D video that's a little bit longer, about 15 minutes long, that talks about the exposures of Medicare Part D and what it actually covers for prescription drug plans. So if you're unsure or need help with your Medicare enrollment, again, my team's here, happy to assist. In the description below, you'll have a link to book a call should you need any assistance. Otherwise, if you found this video of value and liked it, please hit that thumbs up button. That allows us to know we're putting out good content that people enjoy watching. And if you want to be notified whenever we post new Medicare videos to our YouTube channel here, click that red subscribe button. That'll notify you every time a new video gets published. Again, thank you for watching our Medicare Basics series. Medicare Joe here with our Part D Medicare Basics video. Take care.